I found Dr. Herman. When I watched a video, he was talking about his wife, that unfortunately she also had the same problem as I do. And I cried. I cried when I watched the video because I connected. I knew exactly that was my problem, and finally it was someone that I could help me. I am very happy that I decided to come to him in February of this year because it's been only a few months and I already saw the results, and I proved not only to myself but I'm proving to everybody. And I want to tell you women that you are out there, that I know that is very, very difficult for anyone to understand, because not even your partner or your own family, even your mother understands, unfortunately. Why? Because they don't feel it. They can only tell you, I'm here for you, but nobody really knows. Only you and me that we go through. If really, I just want to say something to you, please do not give up, because I almost did, but I always knew that it had to be something else or someone that will be really truthful to help you. And I'm glad that I never lost hope, because that's the last thing you can lose, hope. And I am very, very grateful, thanks to Dr. Herman and his wife, that they have an amazing technology. It's just amazing. I really advise you to please come to see him. He can help you the way he's helping me, and he is also helping so many other women and men with different problems, not only with endometriosis, but it is the main reason why I decided to come to him. So I just want to say that really from the bottom of my heart, do not give up and come to see him. Please, really do. Thank you very much.
Thank you.
Thank you, doctor.
That was great, and welcome. We're going to get a big hug after that.
Yes.
That was really heartfelt. Thank you. Hi, if you are dealing with endometriosis and the pain is so intense and you've been to many different doctors, you deserve to listen to this video. My name is Dr. Herman. I'm with a great patient of mine. Her name is Argelia. And she comes to my clinic from, you live in Illinois, Chicago, Illinois, right?
Chicago,
and you
Illinois.
came to my clinic. You've been coming down here to South Florida for this endometriosis pain condition. How many years? You're now 36?
I am 36.
And how many years have you suffered with this pain that you've had in the reproductive area of your
For
body?
24 long years.
24 long years. And we're going to talk about her symptoms before and after right now, and then I'm going to have her, or allow her to share with you what the experience has been like over those 24 long years and all the doctors that she's been to. But the improvement that she's finally experiencing now is pretty
Amazing.
amazing.
It's just amazing.
Amazing, yeah. And you've been to some pretty tough type of doctors for your condition, so we'll get
Yes.
into that in a little bit. One of the parts of your condition, of this endometriosis condition, and you've been definitely diagnosed with endometriosis before we even start. This is not just you put a label on yourself of endometriosis. You've had, what type of tests actually did they use to diagnose endometriosis?
They did a laparoscopy test in order to find out that I had endometriosis.
Okay.
And unfortunately, yes, I did had it.
Yeah. Okay. So your periods were how many days a month before you came to me? How many days a month were you bleeding?
My periods were 12 days
12 days.
of bleeding, pain, and a lot of blood clots.
A lot of blood clots. Every day there were blood clots in those 12 days?
Every day.
Every day. And multiple blood clots.
Yes.
And how intense was the pain during those 12 days of the bleeding?
From 0
Yeah,
to 10?
if 10 is the worst. 10.
10.
10. And along with that clotting, well, right now, let's go into that. Right now, how many days from 12 days a month with blood clots every day with intense, severe 10 level of pain, how many days a month do you have the bleeding for now?
7.
7. How many months has it now been at 7 days?
It's been 4 months.
4 months. And we started together in February. This is right now October 19th of 2019. She started with me in this care in the middle of February of 2019. So 12 days to 7 days.
Yes.
The intensity of the pain during the period and pre-PMS, of course, before the period, your pain now is at what level when you are having PMS and during the bleeding?
A 6.
So you've gone from a 10 to a 6 in the severity of the pain, and you've gone from 12 days of bleeding to 7 days of bleeding.
Correct.
And 12 days of clotting with the bleeding. Now how many days of clotting in those 7 days of your period? How many days of clotting do you have?
1
1 day of clotting.
day.
That's pretty amazing.
That is amazing.
Super. You had migraines.
Yes.
How many days a month did you have the migraines?
I will have 4 days every week.
4 days a week. And that's not including headaches,
Correct.
because you had 2 different levels of head pain. One you're considering a migraine, one you're considering a headache.
Correct.
So how many days was that? 4 days a week?
4 days a week.
Migraines.
Migraines.
How many migraines do you have now in the month?
None.
Zero.
Zero.
0. And were you taking medications for those migraines in the past?
Yes.
What kinds of medications?
I was taking a lot of painkillers, and every time I would get really sick, I would have to go to the hospital. They put an injection, which I don't remember the name, and you have to go in because you have to be in the hospital for
Under surveillance,
reaction.
sort of.
And it's just constantly, I will have to go to the hospital for 2 times during the month for that injection.
And how many months did you do that for?
For
How many years? If it
7
was?
years.
7 years.
For 7 years.
Every month.
Every month.
Going in, injections, and
Yes.
still dealing with the migraines in the next month.
Yes.
And even in that month, because it didn't really work. So how many days out of the month did you have headaches?
Almost every day,
Mhm.
minimum 5.
5 days a week?
5 days a
minimum
week.
5 days a week.
Yes.
Are you still getting the headaches?
I do once in a while, but only once or twice
Once or twice in the month?
in the month.
In the month.
In a month.
In a month. And that comes up during premenstrual, or that's during the bleeding?
That's
Or does it vary?
it varies. Sometimes before, sometimes during.
So 5 days a week, every week, 20 a month, not including the migraines, down to 1 to 2 times in the month now.
Correct.
Phenomenal. Your energy level, 0 to 10, if 10 was the worst fatigue you could possibly imagine, what was your fatigue level like before you started care with me?
10
How long did you suffer with the 10 of severe fatigue?
for
How many years?
10 years.
10 years. Now your level of energy or your fatigue level, if 0 to 10, 10 is the worst fatigue, 0 means there's no fatigue. Where are you now with your energy level?
5.
5. So you're about 50% better with energy.
Definitely.
You were also anemic.
Yes.
No more.
No more.
No more. And we have proof of blood tests. We're going to show you the reports. I'll merge it into the video so you can actually look at the before and after. Is it okay that I actually show your name in the forms that I show for the blood test that I
Yes.
show? Okay. So you're going to see a before from May of 2019 to, I think this latest one was October of, was it October?
Yes, it was October 23rd.
October 23rd of 2000, no.
I mean, I'm
it's
sorry, September.
September 2020.
September, sorry.
Okay, so within 4 months, you went from being anemic to no anemia to a very healthy iron level and blood count, red blood cell count. Your anemia, how many years again?
For 10.
10 years.
Yes,
So the anemia was 10 years.
correct.
And with that anemia, did you take medical prescription iron supplementation that they gave you?
Yes,
And did that ever fix your anemia?
never.
And what did the doctor tell you when they couldn't get the iron levels up? They couldn't get the hemoglobin and the red blood cell and the iron levels to be normal with that iron medication that they gave you?
They never really said anything because they don't care about you or me or anyone in the whole world. I mean, I'm being really honest, unfortunately. They would just say nothing,
They
really.
would say nothing. That's
They
just-
will do the tests and they will say that it's really bad and that's it. And then I always ask, what can I do? Oh, it'll get better. Take this medication and that's it.
yeah, so
Unfortunately, I tried it and I tried it and I continue doing what they said and never, ever, nothing happened.
nothing. Besides staying anemic.
Besides the
And with excessive bleeding.
yes,
And painful periods.
yes,
And migraines
yes,
and headaches and fatigue.
yes,
And so now, so one way that which I'm going to be making another video describing the care for her that we've done that get her to this point of this dramatic improvement for her that she's enjoying now. But there was part of this was with a specific kind of iron food supplementation that really helped her within 4 months become non-anemic, and that's the first time in 10 years. 10 years of anemia, not anymore. But also it was getting the 12 days of the excessive bleeding and clotting down to 7 days, only 1 day of clotting. So that's a big difference. You've also told me that for a long time you were missing days of work every month.
yes.
How long did you have to actually call in and say, I can't work?
For 2 years.
For 2 years, and because of the endometriosis pain.
Because endometriosis pain.
And the pain was so severe that were you able to even leave the house on those days? Were you in bed, heating bed? What was it like for you?
I was horribly in pain in the bedroom, trying to feel better. I would just stay in the room, would put in a hot pad, and nothing will help. I couldn't function because I can't even walk. I couldn't even walk. So I had to call in sick at work all the time. I had to get a release note that I was
a doctor's
letter that I was in pain all the time, in order for me not to lose my job, because unfortunately most of the jobs, I mean, they can fire with or without reason. So unfortunately I had to get that letter, and now I am very happy because I went back to work full time. It's just been 4 months ago, and I'm very happy. I haven't been able to, I have been not needed to call in sick anymore, because now I can function and I can go to work and not having the pain as I used to. So I am, I work in a restaurant business, so being a waitress, you have to be moving. So with the pain, I was never able to do it. Now I am very happy that I am able to function, and
you're able to function, and there's no missed days of work for 4 months.
And there's no missed days of
And
work.
because the pain is not so intense anymore.
Correct.
That even though the pain is still there in the pelvic region, the severity of it has dramatically decreased.
Absolutely.
Because we're getting rid of specific kinds of infections from the uterus, from the endometrial tissue, from the fallopian tubes, from the ovaries that have never come up in her laboratories in any imaging studies. And I'm going to get into that in the other video. So I just want to keep going along with this. So that's phenomenal. The endometriosis pain that you had, you now have pain that you have, I believe what you told me before, we had a good deep discussion about what's her developments and her improvement before we got into this video. So it was a great long discussion we had before. I wish we had all those points to put into the video right now, but you were telling me that you still have pain during the premenstrual
Yes.
period, right, the PMS, and you have pain during a few days of those 7 days. How many days of the period of the bleeding now, of the 7 days, how many days are you experiencing pain?
2 to 3.
2 to 3.
Mm-hmm.
So how many days is the premenstrual syndrome for you?
Only 1 or 2.
1 or 2.
Mm-hmm.
So 1 or 2 days. So now it's about 4 days of pain, give or take, maybe 5,
Yes.
4, 3, 4,
Yes.
5, right? So, and how many days a month did you feel the pain in that pelvic region of the endometriosis pain before you started care with me? How many days a month was the pain?
20 days.
20 days. Pretty severe.
Very severe.
Yeah. Okay, so what was it like for you since you were 12 years old? And we can get into the history and what's it been like over the course of these 24 years of dealing with the pain. Since you were 12 years old, you had pain in that lower part of your body.
Yes.
And you told me, what was it like for you? You said you thought it was just normal, it was the way you're supposed to be.
Yes, I remember exactly my first period that I started having pain. I didn't know what it was. Then I realized that I'm having my period. My sister-in-law took me to the nearest hospital, and they gave me some aspirin. They said, "Oh, she's okay. It's just pain period." And then was that.
Just pain from the periods.
Correct.
Okay, good.
Then that was that. That was the first day that I exactly remember, because from that, since I'm 12 years until now that I'm 36, I always had it constantly, on and on, every month, every month, every month, every month. I couldn't move, I couldn't walk. Unfortunately, she took me to other doctors, and they would say the same thing. Oh, it's just pain, period. I deal with it for many years. I believe that it was just the way it was, because every doctor that I would go to, it would say the same. It is very difficult to come to the conclusion that unfortunately all of the doctors are wrong. They were wrong, because this is the proof that it wasn't that I had to do like a laparoscopy in order to find out that I had endometriosis, but that was only 4 years ago. And finally, at least, I knew that it was something else, because I even thought that maybe I was crazy. I even went to a psychiatrist and I did everything. I did acupuncture, natural doctors. I mean, I went to every different, like, gynecology, different doctors here in the US and Chicago and even Mexico and other places. Everywhere I went, even on vacation, I would just sometimes get sick and go and see a doctor, and unfortunately all of them would say the same thing. I am very thankful now that I know that it was just not my period, that it was just not pain that you need to get used to it or something normal, that it is a problem. After the surgery, the laparoscopy, supposedly they go in and they clean out, and the pain is supposed to decrease. Unfortunately, it never did. Next month, right after I got my period, unfortunately I had exactly the same or even worse pain. So I was very upset. I went back to my gynecologist and surgeon, who I know him from 6 years, and I was at his office trying to explain to him what I felt, and I asked him what were my options, and unfortunately he said another surgery, which I couldn't do another surgery because first of all, I mean, it costs like $30,000, and second of all, I was very, I don't even know how to put it, very upset, frustrated, because I just didn't know what to do. I said, what are my other options? He said it's either that or the birth control. Unfortunately, I have tried everything, including the birth control, and I've been in the emergency room 9 times because of taking those. So I said to him, I don't know what I'm gonna do. I was crying in his office, and I just said I am gonna go and wait, I guess, for the next surgery. He said to me, whenever you're ready, just come and do it. I guarantee you that this one is gonna be better. I kind of asked him, how do you think it's gonna get better? He said there is a new robot that is called Da Vinci, and they go into your body and, you know, clean up everything, and this is supposed to be better than the first surgery he did. I was just very frustrated because dealing with the pain every single month, 20 days, is just horrible. I don't wish it to anybody. It's been 24 years of my life that I deal with that every single month, every single day. And then one day, it was 4 o'clock in the morning. After that, I was just researching a lot of doctors back and forth. And thankfully, I found Dr. Herman. When I watched a video, he was talking about his wife, that unfortunately she also had the same problem as I do. And I cried when I watched the video, because I connected. I knew exactly that was my problem, and finally it was someone that could help me. I am very happy that I decided to come to him in February of this year, because it's been only a few months and I already saw the results, and I proved not only to myself, but I'm proving to everybody And I want to tell you, women, that you are up there, that I know that is very, very difficult for anyone to understand, because not even your partner or your own family, even your mother understands, unfortunately. Why? Because they don't feel it. They can only tell you, I'm here for you, but nobody really knows. Only you and me that we go through. If really, I just want to say something to you, please, please do not give up, because I almost did, but I always knew that it had to be something else or someone that will be really truthful to help you. And I'm glad that I never lost hope, because that's the last thing you can lose, hope. And I am very, very grateful, thanks to Dr. Herman and his wife, that they have an amazing technology. It's just amazing. I really advise you to please, please come to see him. He can help you the way he's helping me, and he is also helping so many other women and men with different problems, not only with endometriosis, but it is the main reason why I decided to come to him. So I just want to say that really from the bottom of my heart, do not give up and come to see him. Please, really do. Thank you very much.
Thank you.
Thank you, doctor.
That was great. You're welcome. We're going to get a big hug after that.
Yes.
That was really heartfelt. Thank you. I'll put up the number here to the clinic and the email here as well. People come to my clinic, women and men, younger and older, from all parts around the world, from Australia, from Romania, from Slovakia, from Africa, from United Kingdom, from Norway, Netherlands, Israel, from Canada, from all across the US. You can get better. You've just got to step outside the box.
Yes.
This is a real person. I'm going to put up real documentation to prove exactly what she's talking about here, so you can know this is real. And 24 years of suffering, and people who just didn't understand. Family, friends, try to understand, try to be there for her, but could not know the kind of intense pain that she lived with. They were not cold to her. They tried to be there for her, but nobody could really understand what she went through. And all the doctors and the psychologists and the hospitals could not get it right. And here we are overcoming this. And when she's going to be completely done, which is what we're shooting for with this, to be completely done with care, because that's the goal, is to get you better as fast as possible and let you move on with your life. You will hear from her with a book that we'll be coming out with about her journey, her diary about her endometriosis and what it took to overcome this, and that'll be released soon. Okay, thank you so much for sharing this.
Thank you.
Make your call. It's time to get well.